Welcome to Pod Operations Training, Reception. This training will cover the positions and job duties of the staff and volunteers who will be working in the triage reception area. Please pay close attention to the information and instructions you are about to receive. At the end of this video, you'll be given additional instructions by your supervisor. Again, we thank you for your willingness to serve in this public health response. As you may recall, triage reception is the first stage in the four-stage pod process. Here, clients will be greeted and assessed for any medical symptoms and redirected if necessary. Those who are not sick will be given a medical form to fill out and directions and assistance if needed. Let's find out a little more about each position within the reception team and how they work together. Traditionally, the key positions in the reception area are 1. Triage nurse, 2. Greeter, 3. Forms checker. Depending on the scope of the incident and size of the pod, there may be additional positions. As a member of the reception team, you will report directly to the medical supervisor. If you are a triage nurse, you will be responsible for greeting clients and doing a quick medical screening as people enter the pod. If someone is sick or is complaining of symptoms such as a cough or fever, it will be your job to redirect them appropriately. Some people may need to be sent to the acute care area for further evaluation, while others may need to be sent home or transported directly to a hospital or treatment facility. You will be given the screening guidelines from the medical officer in charge, along with guidelines for where to direct people to go. You will also be given instructions for how to call for EMS if needed. In some cases, you may need to ask specific questions relating to the present health and risk of exposure to determine if a client may be symptomatic. If the client is not sick and has no obvious symptoms, you will direct them to proceed to the reception area to begin filling out the medical form. Remember to follow the guidelines you are given for assessing and redirecting people who may be sick or symptomatic. At any time, if you encounter an issue or problem, please notify a supervisor or ask for assistance from a member of the safety or security team. If you are a greeter, you'll be responsible for welcoming each client to the pod and explaining the overall process. First, you will need to brief them on the key messages about the health threat and the medications to be dispensed or administered. Then briefly explain to them the 4 stations of the pod process. First, you will complete a medical form. Second, you will show that form to a nurse so they can determine what type of medication or vaccine to give you. Third, you will receive the medication or vaccine. Finally, you'll be given additional instructions and a chance to ask any questions before exiting the pod. Next, you will hand them the medical forms, along with any other paperwork to be filled out, a clipboard, and a pen. You will want to briefly explain the purpose of the forms and instruct them on how to complete the forms properly. One form needs to be filled out per group or household receiving medication. If the client is needing to pick up medicines for more than 5 people, the client will need a second medication form. Once you give them the forms and instructions, direct them to the form's completion area to begin filling out the form. It is very important to fill out the form completely and accurately. This information is what will be used to determine which medicines to give them and the members of their household. Make sure the client knows that all their questions will be answered during the assessment and dispensing process. Most likely, there will be a radio assigned to the reception area, and you will be given instructions on how to use it. You may need to call for an interpreter to assist clients with reading and filling out forms. If you get low on supplies such as forms, clipboards, or pens, notify a supervisor. If at any point you feel a client is having any medical or mental difficulties, please have them escorted to the acute care area for further evaluations. If you are a forms checker, you will be responsible for assisting clients in filling out the medical form and any other paperwork. Remember, it's very important that people fill out the forms completely and accurately. This information is what will be used to determine which medicines to give them and the members of their family. You will want to be visible so people know you are available to answer questions. It's a good idea to walk around the form's completion area and ask clients if they need any help. When the client is done filling out the form, you will review the form for legibility and completeness. If necessary, direct the client to correct any errors or omissions. Then direct the client to the next stage of the process, assessment. If at any point you feel a client appears unhealthy or distressed, you can ask they be escorted to acute care for further evaluations. As a member of the reception team, you play an important role in the overall pod operation. Remember, you are the first people that clients will come in contact with as they enter the pod. First impressions mean everything, so please be polite and professional when speaking with clients and staff. Remember, too, that a public health emergency can be stressful, and some people may have a hard time coping with their anxiety or fear. Speak to them in a calm and soothing voice, and offer to get them assistance if needed. Always ask the client if there are any questions you can answer. Mental health professionals will be available if needed. If you encounter any issues or problems, please notify a supervisor or ask for assistance from a member of the safety or security team. Thank you for your time and attention. You will now report to the reception area for some further instructions.